Hello all. Today we are going to discuss about quality of a good nurse. My name is Akanksha and I am from School of Nursing and IU. So, what all are the qualities a nurse should have? We will have a discuss about this topic. So, one by one we will see what all qualities a good nurse should have. Then first one, caring, second empathic, then detail oriented, emotionally stable, adaptable, hardworking, quick thinker, physical endurance, good judgment, and good communication skills. So, what all are these qualities? We will see one by one. So, first one is caring nature. So, as we all know, that nurse each and every time used to deal with sick people, sick persons, injured person, and along with them their family members. So, whenever a nurse deal with all these people or all these person, nurse should have the caring nature. Nurse should understand their situation and used to work accordingly. Second one is empathetic attitude. So what is this? Nurse must be able to put themselves in their patient's shoe to provide the quality care need. That means nurse always should understand patient and patient's family members situation and condition, and accordingly nurse should provide care to them. She should understand their pain and their emotions through which they are going through. So, accordingly, she should provide care and emotional support as well. Second one is detailed oriented. What does that mean? Nurse must remember to make entries on patient chart and to bring medication at the correct time. That means whatever procedure or whatever care she is providing or doing with the patient, she should make or maintain the record accordingly and properly. For each and everything, she should prepare the chart. For each and everything, she should enter the remarks in the patient file so that others can refer and go for further proceedings accordingly. Another one is a nurse should stable uh, a nurse should stable in her emotions. She should not become very joyful, or she should not become very sad by seeing the patient. No, she should understand the situation, that is true. She should have the moral support, she should give the moral support, but it doesn't mean that she forget her duty. So nurse feel the joy of seeing a new baby born as well as pain of losing a long-term patient. Then emotion stability is very much required. So here emotional stability is crucial to deal with the wide range of emotion nurse must endure. So if we become too much happy or we become too much sad because of small things, so a nurse cannot provide effective care. So that nurse should control or should stable her emotions, and accordingly she should work. Another thing is adaptable. So in each and every situation, nurse should be flexible. She should understand the situation. She should understand the situation and workload or work responsibilities, and accordingly she should do her work. It should not be like that she is under stress and she is not doing her things in the proper or appropriate manner. So here we have written, people are unpredictable at the best of time but become even more so under stress. So a nurse's typically workday will require flexibility and adaptability. Another one is hard work. Nurse should be a hard worker. Nursing is a never ending job. It is unusual for a hospital or medical center to be overstaffed, which of course means more workload on each nurse in the unit. So as we all know that we are having a shortage of nursing staff in our country also. Nowadays government is taking initiative, but still so many nurses are facing workload or overburden. Then, but then also a good nurse should understand the situation and should not feel overburdened and should overcome from her situation and should do her job with 100%, with her 100%, and should do or provide the care to the patient accordingly. Another one is quick thinker. A nurse should have this quality just for the betterment of the patient. When a nurse notices something is not right with the patient, they must be able to make decision quickly and put their plan into action instantly, because a fraction of a second can mean the difference between life and death. So as we all know that nursing is a profession where nurse deal with the human beings, living human beings. So that means nurse is dealing with a life. So it is very much necessary for a nurse that she should be a quick thinker, and she should have this capacity that as per the situation of the patient, as per the demand of the time, a nurse should be a quick thinker and should have that much guts that she should take the right initiative at the right. Another one is physical endurance. We all know that nursing profession is very difficult, as sometimes nurses used to stand more than 12 hours or 12 hours or 8 hours like that. So nurse should have the physical strength to deal with any condition or situation. She should she should have that strength that she can lift the patient and she can do her things properly, and her physical tiredness cannot or should not be a reason which will affect or which may affect or which can affect the nursing care which should be provided by a nurse. Another one is good judgment. Nurse should have this quality to take the right judgment at the right time. A nurse must be able to look at a patient's current status and accurately assess what is needed, especially during the emergencies. Good communication skill. So we all know that nurse all alone is not doing work in the hospital setting. So there are lot of people who there are a lot of person who are doing work along with the nurse. So nurse should have a good communication skill, just just to explain the procedure to the patient, or just to pass the information to the doctor or to the other co-workers. So nurse must communicate with other, either it is a coordinate or doctor or patient or patient's family. She should know how to speak, when to speak, and how to say the things to the people, and she should have this skill that she can explain in a better way. So these all are the qualities of a good nurse we have seen. So now this is for today, and next topic we will see in the next slide. Thank you.